Welcome to Medicine Handy Points. Today our topic is pulmonary nodule on the chest X-ray and how to approach it. Now, pulmonary nodule is small roundish growth on the lung that is easy to find and hard to diagnose. Pulmonary nodules turn up in about 1 of every 500 chest X-ray. So we should know how to approach it once we find it on a chest X-ray. Before we proceed, if you have not subscribed to the channel, please subscribe for future interesting videos. So, pulmonary nodule. There are 3 steps to be followed once we find it on a chest X-ray. Step 1 is to identify high-risk patient. These are age more than 60, history of smoking, and third, the pulmonary nodule has irregular margins and speckle calcification, not homogeneous, speckle. Now, step 2 is to determine the number of nodules, how many nodules are present, one or multiple. Step 3 is to identify the size of the nodule. Now, once we done these 3 steps, we will proceed. But before that, always laugh when you can. It's a cheap medicine by Lord Byron. So, in solitary pulmonary nodule, if the risk is low, number is solitary, size is less than 6 millimeter, what to do next? Because low risk, single, less than 6 millimeter, no follow-up is a benign. However, if the patient is high risk, number is single, size is less than 6 millimeter, now the patient is high risk, so what to do next? At least CT chest at 12 months. So the difference between these two group of patient is that in high risk patient we do CT chest at 12 months. Now, if the risk is low, number is solitary, and the size is 6 to 8 millimeter. Now the size has slightly increased. What to do next? So we have to do something because the size has increased. So chest CT at 12 months at least. Now if the risk is high, number is single, and size is 6 to 8 millimeter. Now high risk and increased size, what to do next? Chest CT at 6 months. So the difference between these two group of patient is that in high risk we do CT chest at 6 months rather than at 12 months. Now again, if the risk is low, number is single, and size is more than 8 millimeter. Now the size has increased. What to do next? So we have to do something because the size has increased. So CT chest at 3 months. Now if the risk is high, now high risk patient, number is solitary, and the size is more than 8 millimeters. So high risk, more size, what to do next? CT chest at 3 months. So both of this group of patient, both of them get CT chest at 3 months because the size has increased. Now let's take a break because things are getting tougher. With regard to and apologies for the surgeons can cut out everything except cause. Now let's discuss now multiple pulmonary nodule. So if the risk is low, number or multiple, and the size is less than 6 millimeter, so in that case what to do next? Because there are small size, low risk, no follow-up needed. Now what if the risk is high risk patient, number is multiple, size is less than 6 millimeter. Now, because they are high risk patient, we cannot ignore. So CT chest at least at 12 months. So the difference is that in high risk patient, we do CT chest at 12 months. Now, if the risk is low, number is multiple, and size is more than 6 millimeter, now the size has increased. What to do next? Because there are multiple and the size has increased, so CT chest at 3 months. Now, if the risk is high, this number are multiple and size is more than 6 millimeters, so high risk, more size, what to do next? CT chest at 3 months. So both of these patients, because of multiple lesion and increased size now, the criteria is here to do CT chest at 3 months. I hope this has clarified a lot of questions regarding permanent nodule. I hope you liked the video and please subscribe to the channel.